Thank you very much, and also thank you, Dr. Wies, for letting me talk here at this exciting meeting. So, this is my disclosure. Why should we bother looking at bridging StentGrafts? We know from earlier publications that bridging StentGrafts are actually the Achilles heel of fenestrated and branched endografting, with sometimes limiting the patients in their daily life. We know that these StentGrafts do fail in certain ways. They dislocate, they fracture, sometimes you'd also see graft rupture. So that led us to actually test more than 100 bridging StentGrafts that we thought are currently in use. So among this is the V12, the BGraft, BGraft Plus, and VBX. The reason for testing these is that we don't have any clinical information on how especially the newer generation StentGrafts would perform in the long run. So after implanting these into fenestrations and flaring these, we did some microscopy studies, actually seeing some lacerations of graft material, which led us to perform permeability studies on the newer generation StentGrafts, which did perform very well. In contrast to some older generation StentGrafts, I'm not sure if you can actually see it, but there's a hole just from flaring, and that's not even being in the body for a few years. The most important part, however, of our tests were biomechanical testings. We did do some axial tensile force testing, so pull-out testings of the bridging StentGrafts from the nitinol fenestrations, and we also performed shear stress testing, so basically perpendicular pull-out testings, testing the stability of the StentGrafts, emulating a caudal movement of the main body. If you look at the different StentGrafts that we tested here, you definitely see a difference between the newer generation StentGrafts and the older generation StentGrafts, with the newer generation StentGrafts requiring much more force to be actually pulled out of the fenestrations. And if you look at the shear stress force testings here, you see that they are much more close to each other, but still the newer generation StentGrafts are much more stable when it comes to these shear forces that are exerted on them. One thing that we found particularly interesting was that the different devices had different failure modes. So the newer generation StentGrafts slipped out of the fenestrations with partial or complete stentrose separations. And in some of the older StentGrafts, like the BGraft stent here, we could actually observe an entire separation of stent and graft while pulling these stents out. So there has to be a difference in how the different stent designs affect the durability of these tests. What we're working on right now is fatigue testing. So we're testing all 4 different stent types, emulating respiratory movements. And after only a few million cycles, we observed the first graft defects here. In this case, you see basically a nitinol ring that is part of the fenestration that actually protrudes into this advanced stent graft, producing a hole that you can see here, and actually going through the stent graft. We also found some other graft erosions in other stents, and we're continuing the fatigue testings through 30 to 40 million cycles to actually be able to know how many years a stent can actually go with these fatigue testings. So in conclusion, with long-term clinical data on the new devices lacking, we have to look at the in vitro stent graft testings. Here we found that the newer StentGrafts are more resistant to pull-out and shear stress forces, and we also found some differences in designs that led to different failure modes, and we hope that in the future fatigue tests will provide more insights into how the different bridging stents will perform, and we'll keep you up to date on how they will be actually performing in vitro. Thank you very much.